so much, Jackie, and thank you for inviting me. When I got the invite, I didn't know we'd have a general election on the 5th of July, 4th of July. And then I was very happy when I said, can you still make it? And I thought, actually, this is so important. I really want to be here, and I want to, play my part in energizing this campaign and show my support for everyone who's speaking up for the NHS, for a publicly funded NHS. Yeah, it's a privilege to be among all of you. I once read that a leader is someone who wants change. And the reason we're all in this room, is because we want change. So we're all leaders. And what I want to say here today is, please go out and speak about this to everyone. We need the whole country on side. I think Keep Our NHS Public has done a tremendous job in raising awareness, but there's still a lot of ground to cover. We're not natural Daily Mail readers in this room, I don't think, or some, but unfortunately that's what the vast majority of people read. And there's still a huge narrative out there that we can't afford the NHS, really simply. And we have the cheek of reform standing for election. Their core belief is that we can't have a publicly funded NHS. And they go around talking nonsense, and they're allowed to get away with it. So the need to challenge them has never been greater. I just want to say a little bit about the Green Party. I am the Green Party spokesperson for health, social care and public health. And I'm very, very proud of our health manifesto. The Green Party has been very open, very loud and very unapologetic about the fact that we will fund the NHS fully, we will restore it fully, and we've actually costed it completely in our manifesto. So we've shown where the money is going to come from. And it's not going to come from the bottom half of society, it's going to come from wealthy people. We will tax them more, we will tax oil and gas companies, we will put a windfall tax on banks. There's a lot of money floating around. So never ever believe the argument what if people say, oh, where's the money going to come from? It's much, much cheaper to go with our existing model of a publicly funded NHS than to attempt any alternative. It's true that other countries like Germany and France have slightly more complex healthcare systems, they do work, but it's also true that on the whole they pay more for their health service. We pay between 20 and 30% less for the NHS as of today compared to France and Germany. And these are the healthcare systems we should be comparing ourselves with. Those are the outcomes that we should be at. So there's a desperate need to make up that shortfall in funding and to bring us back to where we need to be. The fundamental problem with the NHS currently is a staffing crisis. If you don't have the staff, you can't run a quality service. And it astonishes me how people don't seem to see that. You have scandal after scandal about the NHS, about GP waits, the mourning, the jokes, the despair is palpable. The same with hospital waits. And yet nobody seems to connect the dots. If you don't pay for proper staff, you're not going to be able to get a good service. You pay peanuts, you get monkeys. It's true, isn't it? Nobody expects a bus driver to run 2 buses at once. So why is it that our healthcare professionals are expected to do 2, 3, 4 times the amount of work that any one person can safely do? It's having a devastating effect on the NHS. And I'm shocked beyond belief that neither of the 2 major parties will agree to a pay restoration for our junior doctors. I'm simply shocked. Labour will not commit to restoring their pay. And in fact, please tell people this one simple fact. Junior doctors' pay currently starts at £15 an hour. They're asking for a princely uplift of 35%, which takes them to just under £20 an hour as a starting pay. Which of us can get a plumber to come to our house for less than £40, to knock on your door for less than £40? And yet these doctors have finished 6 years of arduous training, and they're going to be, from the day they set foot in a hospital to begin their foundation year, they are responsible for our lives. Any of us could have an accident, any of our loved ones could end up in an A&E, and it's these doctors who are going to make those initial decisions which could make or break. And how little do we have to value these people? Please, if you have any influence with West Streeting, ask him, how can he refuse to pay junior doctors £20 an hour as a starting pay? In what world is that sensible? So we've been very clear in the Green Party, we are going to sit down with them and have sensible pay talks. Obviously, pay is not the only thing. Working conditions are really important as well. We were talking on our table earlier, and everybody agreed there's a great moral injury happening right across the board. Nurses were shafted with the pay when they did the strike last year. They agreed to some small uplift and then got left out of the other uplift that was agreed with the rest of the healthcare sector. Nurses are leaving, midwives are leaving, doctors are leaving the health service. It's getting worse every single day. People are fed up. Some of them are striking, some are leaving. Soon we will not have a health service worth the name. People are coming from abroad, and I've been told, again, somebody on our table, that they get looked after for 6 months. They get a bit of accommodation given to them, bit of hand-holding and training. After 6 months, these nurses are then left to their own devices to look after themselves. And these are on pretty basic pay. So we're not doing a good job at all. We're not training our own staff, and we're not looking after the ones who come from abroad to actually prop up the service. The other thing I really want everyone to be aware of and to spread word about is the diluting of the qualifications of healthcare professionals. So there's a systematic and sinister attempt to dumb down the quality of healthcare professionals right across the NHS. So instead of having properly trained doctors and properly trained nurses, we have physicians associates, anesthetic associates, and nursing associates. The name itself is so misleading. An associate implies someone who's actually, got a pretty decent qualification and who's able to do the jobs. These grades, this cadre is an import from the United States, not surprisingly, where they're actually called physician's assistants. Much more accurate description of the role that they perform in the US, where they go around taking bloods and acting as helpers to the doctors, so that the doctors can then make the clinical decisions and look after their patients. They came here to a cash-strapped NHS, and lo and behold, got rebadged as associates. And as of today, hundreds of them are actually holding middle-grade doctor briefs in hospitals, above those for foundation doctors. They're getting paid as middle-grade doctors after a 2-year degree, which literally skims the surface, gives them no understanding of anatomy, physiology, pharmacology, all the basic sciences that every single doctor studies before they graduate. It's a complete scandal, and what we're heading for is a 2-tier health service. If you're wealthy, you'll get to see a properly trained doctor or nurse. But if you have no means, you end up with these people who have no understanding of what they don't know. You can't treat something that you don't know. You can't be worried about something that you don't even know exists. We have anecdote after anecdote of, basic things like DVTs being missed, a clot in the leg, pretty basic thing. And they've been missed. Lots of things have been missed. And of course, that's not to say that doctors don't miss things occasionally. General practice especially, the whole profession is about risk. We are risk assessors, our GP, but profession, what we do first and foremost is we assess risk. But in order to do that, you need a really good understanding of all the things that something could be. And then you need to have, the ability to take a history, do an examination, get investigations done, and then make an assessment of what is this problem? Is this, have I done enough safety netting to make sure it's not the worst possible thing? What's the most likely thing it could be? And how I explain this, communicated this to the patient in front of me. All of this is missing. So, please spread word about this. Every lay person I've talked to about this is shocked. They have no idea this is happening. And NHS trusts are actually advertising these posts. They've even dropped the name associate now. They're calling them physicians. I've seen this on Twitter. It's that bad. And they need to be challenged. If there was ever a lack of transparency, this is it. This is a con. The public are being conned. And nobody wants to go down that route. We can't afford not to have a national health service which is publicly funded. Our entire society is built on that. We would all immediately, instantly become so much poorer if we didn't have the NHS. So it's never been more important to fight for the NHS and to restore it. Labour's not doing a good job of it, and unfortunately, what I'm hearing on the doorstep is so many people saying, yeah, we love green policies, but we're desperate to get the Tories out, so we're going to vote Labour. This is sending an entirely wrong signal to the Labour leadership. They think that they're doing what the public wants if you endorse them. So please, for goodness sake, do not give them your votes. And I'm not saying this just because I'm green, I'm saying this because every time you vote for a party, you're actually endorsing their direction of travel. Labour was predicted to win massively anyway, so it's very, very likely that they will form the next government. NHS campaigners, I think, shouldn't give them our votes. We should give them to one of the smaller parties because they need to get the message that their direction of travel is completely wrong. The public will not accept them going in cahoots with private companies and giving our money, our hard-earned taxpayers' money, to private companies. We mustn't stand for it, otherwise, we're going to be on the same path to ruin, and it'll be too late in a few years' time to save the NHS. Already we're seeing doctors and nurses desperately looking for jobs because of this new associate thing that's coming in. I saw on Twitter recently, apparently there's an Uber taxi driver, a fully qualified doctor driving taxis because he can find a job. It's already happening today. We can't afford to lose these people. It costs the taxpayer £500,000 to train a doctor. So they're paying fees out of pocket, so they're about £100,000 out of pocket anyway by the time they train. But we taxpayers are paying £500,000 to get them trained. And then to lose them in this manner to other professions is scandalous. Please, let's have a look at it. I'll end here, but I'll just put in one little word for public health as well. Public health has been decimated under this government, and again, we don't talk enough about it. And public health is where the real genius lies. If we invest properly in public health, we could save money up front, and the NHS would have no problem, balancing its budgets. Gains in public health are very quick to realise. I'll give you 3 very quick examples. The low emission zone in London has already reduced admissions with asthma to A&Es. Deaths have gone down. The minimum alcohol pricing that was introduced in Scotland within 2 years reduced admissions related to alcohol and reduced deaths related to alcoholism and liver cirrhosis. And the third example, which I've made a note of, is sugar. So we had a very weak and very pathetic sugar tax on high sugar drinks, which was brought in. Within 2 years of that coming in, we've seen a fall in the number of children needing teeth extractions. So public health measures are the way to go. The Green Party is fully behind a proper increase in investment in that, and we all need to be shouting about that. So this is slightly stepping back the NHS, but really, really important because we need to save the NHS and we need proper public health in order to do that. I think my time's up. Happy to take questions, but I also agree with what my previous speaker said. We must always drive for better quality in the NHS, but I think it's really harsh to ask NHS staff to improve their quality when they're doing the work of 2 or 3 people individually.